Someone should see a doctor for their neck pain or back pain if their symptoms are not going away in a couple of weeks. They should also see a doctor if they're having any nerve-related issues, if you're having weakness in your arms or your legs, or if you're having any bowel or bladder issues. Those are reasons that one should get to a doctor sooner rather than later. The majority of patients that we see in the office are treated non-surgically. I would say that only about 1% of the patients that we see need surgery, and that's obviously good. I'm a surgeon, but I try not to do surgery if we don't have to. The majority of patients that I see in my office get better with a combination of medication, physical therapy, sometimes injections. Only about 1% really require surgical intervention. Surgery is needed if we've tried everything conservatively and it hasn't worked. If patients still have symptoms after we've tried typically at least 6 weeks of conservative treatment, whether it's a combination of time, medications, injections, and none of that has worked and they continue to have symptoms, then surgery is needed. Sometimes surgery is needed emergently should anybody develop any bowel or bladder issues or any weakness in their arms or legs, because sometimes the weakness, if we don't get to it soon enough, is irreversible. Most of the surgeries that I do relate to disc issues, where the disc, and I tell people the disc is sort of like a jelly donut, can herniate, rupture, which is basically the same thing, can come out, pinch a nerve, and then we have to remove that part that's pinching the nerve. The goals of the treatment are to get patients out of their pain, hopefully restore their strength, get rid of their numbness and tingling, and get them back to the quality of life and the functional ability that they were used to before all their symptoms started. That's the goal of any surgery in orthopedics. Our goal is functional restoration, and that's also our goal in spine surgery. When I look at a place to do surgery at for my patients, the number one thing I look at is patient safety, because that is paramount. And I've been coming to Holy Cross Germantown Hospital from its inception because I always felt it was a very safe place to bring my patients. In addition to that, what I'm also looking at is to make sure that the facility offers the most technologically advanced equipment that I need to do to perform our delicate spine surgery. And Holy Cross Germantown offers that. We have excellent nurses over here. We have state-of-the-art equipment, including top-of-the-line microscopes. We have nerve monitoring here. So Holy Cross Germantown Hospital offers a place where we can do our procedures in a very safe and very technologically advanced arena.